stop. Do not scroll past this. Take one slow breath in right now and exhale slowly. Did you feel that? That faint pulse in your neck, that slight heaviness behind your eyes when you woke up this morning. Here's the question almost nobody thinks to ask. What is your blood pressure doing at 4:37 in the morning? Because here is what is terrifying about that question. If your blood pressure is dangerously high right now, at this very moment, while you are sleeping tonight, you will not feel it. There is no alarm. There is no warning. There is no pain that wakes you up in time. Most strokes do not happen in the afternoon while you are busy and alert. Most heart attacks do not happen while you are at the grocery store. They happen in the early morning hours while you are completely asleep, while your body is supposed to be recovering. And what you drink in the hours before you go to bed tonight could either help protect you through that window or quietly work against you without you ever realizing it. That is not a scare tactic. That is just physiology. And the sooner you understand it, the sooner you can do something about it. Stay with me, because what I am about to share with you is not something most doctors take the time to explain clearly. And by the end of this video, you are going to understand your own cardiovascular risk in a way that most people never do. I am Dr. Megan Foster. I spent over 2 decades in surgical and cardiovascular practice. I have sat with patients who had perfect daytime blood pressure readings and still suffered strokes. I have reviewed ambulatory blood pressure reports, the kind that measure your pressure every 30 minutes throughout the entire night. And I have seen patterns that should have been caught years earlier. Here is what most people are never told. Your daytime blood pressure reading at your doctor's office is only one piece of the puzzle. It might actually be the less important piece. The real danger zone is what happens to your blood pressure while you sleep. In a healthy cardiovascular system, blood pressure naturally drops during sleep. It falls somewhere between 10 and 20% below your daytime average. This is called nighttime dipping. And it is not just a curiosity. It is an active protection mechanism. While that drop is happening, your heart is resting, your blood vessels are relaxing, your kidneys are filtering more efficiently. Your entire cardiovascular system is doing its most important recovery work of the day. But here is the problem. Research shows that up to 40% of people with high blood pressure do not experience this drop. Their blood pressure stays elevated all night long. Or worse, it spikes dramatically between 4 and 6 in the morning. That 4 to 6 a.m. window is when cardiovascular events are most likely to occur. That is when the combination of rising cortisol, increased heart rate, and blood vessel stiffness creates the most dangerous conditions of the entire 24-hour cycle. These people are called non-dippers, and most of them have no idea they are in this category because nobody is measuring their blood pressure at 3 in the morning. Nobody is checking what their vessels are doing while they sleep. The standard blood pressure cuff at your annual checkup tells you nothing about this. Now, let me ask you something personal. Think back. Think back 10 years ago, maybe 15. Did you fall asleep more easily? Did you wake up feeling genuinely refreshed? Did mornings feel calmer? Did your body feel quieter when you opened your eyes? Now compare that to today. You wake up and something just feels off. There is tension in your neck, a dull pressure behind your forehead. You feel tired even though you technically slept. You wake up once or twice in the night and cannot figure out why. None of this feels dramatic. It just feels like getting older, like something you accept. But here's what I want you to hear very clearly. This is not simply aging. Loss of nighttime blood pressure dipping is not something that was always going to happen to you. It is not written into your genetics as something unavoidable. It is physiological. It is driven by specific, measurable, influenceable factors. Things like inflammation, stress hormone patterns, fluid balance, kidney signaling, and vascular stiffness. All of these things can be moved in a positive direction. And one of the most underestimated ways to influence them is so simple, it almost sounds too easy to be real. It is what you drink before you go to bed. Now, before I get into the specific drinks, I need to make sure you understand the actual mechanism at work here. Because if you understand the why, these recommendations stop sounding like folk remedies and start making biological sense. Picture your arteries like garden hoses. Flexible, elastic hoses. During the day, pressure inside those hoses rises and falls constantly in response to movement, stress, food, emotions, and activity. That is completely normal. The hoses stretch and relax thousands of times throughout the day. At night, those hoses are designed to relax almost completely. The inner lining of your arteries, a thin layer of cells called the endothelium, plays a major role in this. When it is functioning properly, it releases a molecule called nitric oxide. Nitric oxide tells the surrounding muscle in the artery wall to relax. The vessel widens, blood flows more easily, pressure drops, the system resets. But when stress hormones like cortisol and adrenaline stay elevated into the night, when low-grade inflammation is present in the bloodstream, when fluid balance is disrupted, or when the kidneys are under strain, the endothelium cannot do its job properly. Nitric oxide production drops. The vessels stay tight. The hoses stay under pressure, and the body never gets its nighttime reset. That is what a non-dipper looks like on the inside. And that tight, pressurized state at 5 in the morning when cortisol is naturally rising again to prepare your body for waking, combined with vessels that never relaxed overnight, is an extremely dangerous physiological situation. Large studies using 24-hour blood pressure monitoring have shown that people who are non-dippers have significantly higher rates of stroke, heart failure, kidney disease, and overall cardiovascular death, even when their average daytime blood pressure looks completely acceptable. Some researchers now argue that nighttime blood pressure status is more predictive of cardiovascular mortality than daytime readings alone. This is not fringe research. This is published in mainstream cardiology literature. The European Society of Cardiology considers nighttime blood pressure a critical measurement. The American Heart Association has acknowledged its importance for years. The problem is that most routine clinical visits do not include nighttime blood pressure monitoring unless a specific concern has already been raised, which means the majority of people in the non-dipper category are walking around completely unaware. So, what can you do about it tonight? What can you do in the next hour before you go to sleep that will actually support your body's ability to dip properly? Tonight, I am going to walk you through 3 specific bedtime drinks that have real scientific evidence behind them for supporting lower blood pressure overnight. I am going to go in order from foundational to clinically powerful, and I am going to tell you exactly how to use each one, what dose actually matters, what time to drink it, and what mistakes most people make that cancel out the benefits. The number 1 drink on this list has been studied in multiple controlled clinical trials. The results showed average reductions in systolic blood pressure of more than 7 millimeters of mercury. That is not a trivial number. Some prescription blood pressure medications in their standard doses produce reductions in that same range. But first, before we dive in, I want to ask you something. Have you ever actually measured your blood pressure first thing in the morning? Before you eat anything, before you drink anything, before you even get out of bed? That morning number is one of the most important cardiovascular data points you can track, and most people never do it. Tell me in the comments what your typical morning reading looks like. We genuinely learn from each other here, and your answer helps me create better content for this community. Now let us start with drink number 3. And I want to start by correcting a misconception because this one gets dismissed constantly. Low-fat milk. The typical reaction when I mention this is a shrug. Milk is neutral, people think. It is just a food. It does not really do anything for blood pressure. That assumption is wrong. Low-fat milk contains 3 minerals that work together in a very specific way to support healthy vascular function: calcium, magnesium, and potassium. These 3 minerals are not just generally healthy. They play direct roles in how your blood vessels contract and relax, and how your kidneys manage fluid and sodium balance. Let me explain each one briefly. Calcium is involved in muscle contraction throughout your body, including the smooth muscle that wraps around your blood vessels. When calcium regulation is off, those muscles can stay in a more contracted state. Blood vessels tighten, pressure rises. Potassium works partly by helping your kidneys excrete sodium. Most people know that excess sodium raises blood pressure. What they do not think about is that adequate potassium is one of the mechanisms that counteracts that effect. When potassium intake is low, which is extremely common in modern diets, sodium is retained, fluid is retained, and blood pressure trends higher. Magnesium is perhaps the most underappreciated of the three. Magnesium acts almost like a natural calcium channel blocker, which is exactly how a whole class of blood pressure medications works. It helps relax vascular smooth muscle. It supports nitric oxide production. It has mild natural calming effects on the nervous system, which matters for overnight cortisol levels. Multiple large observational studies have found that regular consumption of low fat dairy is associated with meaningfully lower risk of developing hypertension. The DASH diet, which is one of the most well researched dietary approaches for blood pressure, specifically includes 2 to 3 servings of low fat dairy per day as one of its core components. The DASH diet has been shown to reduce systolic blood pressure by 8 to 14 millimeters of mercury in clinical trials. That is a significant and clinically meaningful reduction. Now, the timing here matters. 1 cup of skim or 1% milk consumed 30 to 60 minutes before bed gives your body time to begin absorbing those minerals during the early sleep window when the nighttime dipping process ideally begins. The most common mistake people make with this one is choosing whole milk instead. The saturated fat content in whole milk appears to partially counteract the vascular benefits of the calcium and potassium. The research on dairy and blood pressure consistently points toward low fat varieties as the beneficial option. This is not about calories, it is about the specific vascular mechanism being supported. One more thing worth mentioning about milk and sleep: it contains small amounts of tryptophan, a precursor to serotonin and melatonin. This will not knock you out, but it contributes in a minor way to the overall effect you are aiming for with a bedtime drink, which is a gentle, calming signal to the nervous system before sleep. Simple, foundational, backed by decades of dietary research. Underrated? This is drink number 3. But now let us move to something that works through a completely different pathway. And this one surprises people because they think of it as a relaxation tool, not a cardiovascular one: chamomile tea. The misconception here is this: chamomile helps you sleep, sure, but it is not really doing anything for your blood pressure. It is just calming you down. That framing misses the entire point. Sleep quality and blood pressure are not two separate things. They are deeply, directly, mechanistically linked. And once you understand that connection, you realize that anything that meaningfully improves your sleep is, by definition, improving your cardiovascular risk profile overnight. Here is the chain of events. When you sleep poorly, several things happen simultaneously in your body. Cortisol levels stay elevated longer into the night and rise earlier in the morning. Your sympathetic nervous system, the fight or flight system, remains more active. Inflammatory markers in your blood increase. All three of these effects independently keep blood pressure elevated and directly suppress your body's ability to achieve nighttime dipping. Poor sleep is not just unpleasant. Poor sleep is a cardiovascular risk factor. Multiple large studies have demonstrated that people who sleep fewer than 6 hours per night, or who have poor sleep quality as measured by sleep studies, have significantly higher rates of hypertension, heart attack, and stroke compared to people who sleep 7 to 8 hours of quality sleep. Some of this association is explained entirely through blood pressure mechanisms. Now, where does chamomile come in specifically? Chamomile contains a compound called apigenin. Apigenin binds to receptors in the brain that are part of the same system targeted by certain calming medications. It reduces anxiety signaling, promotes relaxation, and supports the transition into deeper, more restful sleep without the dependency risks associated with pharmaceutical options. Studies on chamomile have shown reductions in anxiety scores, improvements in sleep quality metrics, and in some trials, modest reductions in inflammatory markers that are directly associated with vascular dysfunction. One study specifically found improvements in nighttime cardiovascular parameters in participants who consumed chamomile extract regularly. The mechanism is not complicated. Chamomile quiets the nervous system. A quieter nervous system means lower nighttime cortisol, Lower nighttime cortisol means less sympathetic activation on your blood vessels. Less activation means better relaxation. Better relaxation means better dipping. You do not need to have a diagnosed anxiety disorder for this to apply to you. Most adults in modern life are carrying chronic low grade stress that they have normalized. They do not think of themselves as anxious because they function, but their cortisol curves at night tell a very different story. Now for the usage: 2 tea bags, not one. This is where most people shortchange themselves. One tea bag steeped for 2 minutes is not going to produce a meaningful concentration of apigenin. You need 2 bags steeped for a minimum of 5 to 7 minutes with the cup covered, ideally covered with a small plate to trap the steam and prevent the volatile compounds from escaping during steeping. Drink this 30 to 45 minutes before you intend to go to sleep. You want the apigenin in your system and beginning to work before your head hits the pillow, not after. The most common mistake with chamomile is weak preparation. People grab a single bag of a generic grocery store blend, steep it for 90 seconds in lukewarm water, and then wonder why they do not notice any effect. Chamomile is dosed by concentration. Proper steeping matters more than most people realize. There is also a secondary benefit worth mentioning: the ritual itself. The act of preparing a warm drink, holding it, sitting quietly for a few minutes, has a measurable calming effect on the nervous system that is entirely separate from the chamomile's pharmacological action. You are essentially training your body's arousal system to begin winding down at a consistent time each evening. Over weeks, this becomes a genuinely powerful sleep anchor. Now we are moving into the third category. This is where the clinical trial data becomes difficult to ignore. We are talking about something that is not a supplement, not a medication, not something you have to special order. It is a tea, a deeply colored, tart, beautiful red tea that has been consumed for centuries in parts of Africa and the Caribbean, and that has now been studied in multiple rigorous clinical trials for its effects on blood pressure. Hibiscus tea. Specifically, tea made from hibiscus sabdarifa, the dried calices of the hibiscus flower. The misconception: it is just herbal tea. It is pleasant. Maybe it has some antioxidants, but it is not going to move the needle on something as serious as blood pressure. This misconception is not just wrong, it is significantly wrong. Hibiscus works through multiple distinct biological pathways simultaneously. Let me walk you through each one, because understanding these mechanisms is what separates someone who uses this correctly and consistently from someone who drinks it twice and forgets about it. First pathway: hibiscus functions as a natural ACE inhibitor. ACE stands for angiotensin converting enzyme. ACE inhibitors are one of the most widely prescribed classes of blood pressure medication in the world. They work by blocking a specific enzyme in what is called the renin-angiotensin-aldosterone system, a hormonal pathway that regulates blood vessel constriction and fluid retention. When ACE activity is blocked, blood vessels relax, sodium excretion improves, and blood pressure falls. Hibiscus compounds, particularly the anthocyanins that give it its deep red color, have been shown in laboratory and human studies to inhibit ACE activity by a meaningful amount. Second pathway: hibiscus improves endothelial function. Remember the endothelium, that thin lining of cells inside your arteries that produces nitric oxide? Hibiscus appears to directly support that lining's ability to produce nitric oxide, which, as we discussed, is the primary signal that causes blood vessels to relax and widen. Damaged or dysfunctional endothelium is one of the earliest and most important changes in the development of cardiovascular disease. Supporting it matters enormously. Third pathway: hibiscus has mild diuretic properties. It gently increases the rate at which your kidneys excrete sodium and fluid. This reduces the total fluid volume in your circulatory system. Less volume means lower pressure. This is the same mechanism used by another major class of blood pressure medication called diuretics, sometimes called water pills. Fourth pathway: hibiscus reduces arterial stiffness. As we age and as cardiovascular risk factors accumulate, the walls of our arteries become progressively less flexible. Stiff arteries do not absorb the pressure wave from each heartbeat as effectively. Blood pressure rises as a result. Research on hibiscus has shown measurable improvements in arterial elasticity markers, suggesting it is not just dilating vessels temporarily, but actually supporting the structural health of the arterial wall. Now, the clinical trial data. Multiple randomized controlled trials, the gold standard of medical research, have examined hibiscus and blood pressure. A meta-analysis examining several of these trials found an average reduction in systolic blood pressure of approximately 7 millimeters of mercury. Some individual trials have shown even larger effects, with systolic reductions approaching 10 millimeters in participants with stage 1 hypertension. To put that in perspective, the first-line prescription medication often used for mild hypertension, lisinopril at its standard starting dose, typically produces systolic reductions in a similar range. I want to be very careful here. I am not saying hibiscus replaces medication. I am not saying that. What I am saying is that the effect size is clinically meaningful, not a rounding error, not a placebo effect, not wishful thinking. One study compared hibiscus tea directly to a low-dose ACE inhibitor and found comparable blood pressure reductions over a 6-week period. The researchers described the effect as genuine and medically significant. For the overnight blood pressure benefit specifically, the timing of your second serving matters. Here is the protocol that research supports. 2 servings of hibiscus tea per day. Your first serving in the late afternoon, around 3 to 5 p.m., captures the systemic ACE inhibiting and diuretic effects during the waking hours. Your second serving, 45 to 60 minutes before bed, positions the endothelial and nitric oxide supporting effects to be active during the early part of your sleep window, precisely when nighttime dipping should be initiating. Preparation matters significantly with hibiscus. You need 2 to 3 grams of dried hibiscus per serving, which typically means 2 tea bags or 1 heaping tablespoon of loose dried calyces steeped in hot water for a minimum of 6 to 8 minutes. Many people understeep hibiscus because the color deepens quickly and they assume it is ready. The color comes first, but the full anthocyanin concentration takes longer to fully extract. Do not add sugar. Sugar acutely elevates blood sugar, triggers an insulin response, raises inflammation markers, and blunts the vascular benefits you are trying to achieve. If the tartness is a problem, and hibiscus is genuinely quite tart, a small amount of raw honey is acceptable. Honey has a different glycemic profile than refined sugar and does not appear to counteract the vascular mechanisms at the doses typically used in tea. The most critical mistake people make with hibiscus is inconsistency. They try it for a few days, do not notice a dramatic change, and stop. Here is what you need to understand about how hibiscus works over time. The endothelial adaptations, the improvements in arterial stiffness, the cumulative ACE inhibiting effects, these do not happen in 3 days. The research shows that measurable vascular changes typically require 2 to 4 weeks of consistent daily use before blood pressure readings begin to reflect the underlying physiological improvement. Week 1, you are building concentration. Week 2, the endothelium is beginning to respond. Week 3, the renin-angiotensin system is beginning to adapt. Week 4 is when many people first see a shift in their morning readings. If you stop after day 5 because nothing seems to be happening, you are leaving the entire therapeutic effect on the table. Now, I want to add some additional context about what affects your overnight blood pressure that goes beyond the drinks themselves, because the drinks are one piece of a larger picture, and understanding the rest of the picture makes everything more effective. Let us talk about sodium timing. Most people think of sodium as a blood pressure issue in general, meaning high sodium intake raises blood pressure. That is true. But what is less understood is that the timing of sodium intake specifically affects overnight blood pressure patterns. Eating a high sodium meal within 2 to 3 hours of bedtime appears to impair nighttime dipping more significantly than the same meal eaten earlier in the day. The kidneys need time to process and excrete the extra sodium load. And if you go to sleep before that process is complete, your blood pressure will stay elevated longer into the night. This is one reason why a heavy, salty dinner followed immediately by bed is one of the worst patterns for overnight cardiovascular health. Let us talk about alcohol. Many people have a glass of wine or beer in the evening as a way to relax. The initial sedative effect of alcohol does make falling asleep feel easier, but alcohol has a significant rebound effect in the second half of the night. As it is metabolized, it activates the sympathetic nervous system, increases cortisol, disrupts deep sleep architecture, and critically raises blood pressure during the 4 to 6 a.m. window, exactly the window we are trying to protect. Research consistently shows that even moderate alcohol consumption, 1 to 2 drinks in the evening, worsens nighttime blood pressure dipping patterns. People who eliminate evening alcohol frequently see their morning blood pressure readings improve within 1 to 2 weeks, independent of any other changes. Let us talk about light exposure. This is one that almost nobody considers in the context of blood pressure. The blue wavelength light emitted by phones, tablets, and television screens suppresses melatonin production. Melatonin is not only a sleep hormone, it also has direct vascular effects. Melatonin has been shown to support nighttime blood pressure dipping through its effects on the nervous system and vascular tone. When you scroll on your phone until midnight, you are not just disrupting your sleep, you are actively impairing the hormonal cascade that supports overnight blood pressure reduction. Even 30 minutes of screen free time before bed, combined with the bedtime drink protocols we have discussed, creates a meaningfully different physiological environment for your cardiovascular system to operate in overnight. Let us talk about meal timing and blood sugar. When you eat a large meal close to bedtime, particularly one with significant refined carbohydrates, your blood sugar rises. Your body releases insulin to manage it. This process is metabolically demanding and keeps your body in an active processing state when it should be shifting into recovery mode. Elevated blood sugar is directly associated with endothelial dysfunction, and endothelial dysfunction directly impairs nighttime dipping. Finishing your last significant meal at least 2.5 to 3 hours before bed, and keeping that meal relatively light and low in refined carbohydrates if you do need to eat close to bedtime, supports the vascular conditions we are trying to optimize. Let us talk about water intake timing. Hydration status affects blood pressure, dehydration raises it. But drinking a large amount of water right before bed can fragment your sleep with bathroom visits. And fragmented sleep, as we discussed, raises overnight blood pressure through cortisol and sympathetic nervous system mechanisms. The sweet spot is to be well hydrated throughout the day and then taper your fluid intake in the hour before bed, relying on your intentional bedtime drink as your final fluid rather than adding it on top of a large glass of water. Let us talk about sleep position. This one is genuinely surprising to most people. Research has found that left side sleeping appears to be associated with slightly better blood pressure regulation overnight compared to right side sleeping. The proposed mechanism involves the relationship between sleep position and kidney blood flow. The left kidney is positioned differently than the right and may drain more efficiently when you sleep on the left side, supporting better overnight fluid balance. This is a modest effect and not the most important variable in the picture. But if you are already implementing the other strategies and looking to optimize further, sleep position is worth being aware of. Let us talk about the relationship between breathing and overnight blood pressure because this is something that affects an enormous number of people and is massively underdiagnosed. Sleep apnea, the condition where breathing repeatedly stops and restarts during sleep, is one of the most powerful drivers of non-dipping blood pressure patterns. Every apnea event, every moment where breathing stops, triggers a brief surge in sympathetic nervous system activity, cortisol, and blood pressure. If this is happening dozens of times per night, the cumulative effect on overnight blood pressure is severe. The vast majority of people with sleep apnea do not know they have it. They may snore, or their partner may report snoring, but they have normalized it as just part of how they sleep. If you have persistent morning blood pressure elevation despite trying lifestyle modifications, if you snore heavily, if you wake up feeling unrested despite adequate sleep time, a sleep study is worth discussing with your doctor. Untreated sleep apnea dramatically limits the effectiveness of any other blood pressure intervention, including medication. Now, let us come back to the drinks and bring this all together because context and combination are where the real leverage is. When you combine the mineral support of low-fat milk, the nervous system quieting effect of chamomile, and the multi-pathway vascular action of hibiscus, you are not just doing three separate things. You are addressing three distinct physiological mechanisms simultaneously. The magnesium and potassium from the milk support vascular muscle relaxation and sodium excretion. The apigenin in chamomile reduces the nervous system activation that keeps cortisol elevated overnight. The hibiscus works on the ACE pathway, the endothelium, the diuretic mechanism, and arterial stiffness at the same time. These mechanisms are additive. They reinforce each other. A practical protocol for someone starting out might look like this. In the late afternoon, around 3 or 4 in the afternoon, brew a strong cup of hibiscus tea, 2 bags or 2 teaspoons of loose dried calluses steeped for 8 full minutes. Drink it before 5 p.m. Then in the evening, 60 to 90 minutes before bed, eat your last meal if you have not already. Keep it relatively light. About 45 minutes before bed, brew your chamomile. 2 bags covered steep, 5 to 7 minutes. About 30 minutes before bed, finish with a small cup of low-fat milk, roughly 6 to 8 ounces. You are going to bed with your nervous system quieted, your vascular minerals topped up, your ACE pathway gently inhibited, and your endothelium prepared to produce nitric oxide during the hours your blood pressure should be dipping. Track your morning blood pressure. Same arm, same time, same position every morning. Ideally, take 2 readings 2 minutes apart and average them. Write them down. You are looking for a trend over 2 to 4 weeks, not a single reading. Blood pressure varies naturally from day to day. What you are watching for is a gradual shift in your average morning number. That shift, when it comes, is real physiological change. Now, I want to address safety directly because some of you are on blood pressure medication and you deserve a clear and honest answer about how these drinks interact with that. Hibiscus can genuinely enhance the blood pressure lowering effects of ACE inhibitors, calcium channel blockers, and diuretics. This is not theoretical. It has been observed in clinical settings. If you are on any of these medications and you start drinking hibiscus twice daily, you need to monitor your blood pressure more closely than usual in the first 2 weeks. The goal is to avoid your pressure dropping lower than is comfortable. Lightheadedness when you stand up, dizziness in the morning, or readings that are consistently lower than your baseline would all be reasons to have a conversation with your physician about whether your medication dose needs adjustment. This is actually a good problem to have in many cases, but it is one that requires communication with your doctor. Do not manage it alone. Chamomile is extremely well tolerated for most people. The one group that should use caution is anyone with a known allergy to plants in the daisy family, which includes ragweed, chrysanthemums, and marigolds. Cross-reactivity is possible, though uncommon. Low-fat milk is obviously not appropriate for people with lactose intolerance or dairy allergy. For those individuals, unsweetened oat milk that has been fortified with calcium and potassium is a reasonable substitute. The mineral profile is not identical, but it is supportive. None of these drinks are replacement therapy. If your doctor has prescribed blood pressure medication, continue taking it exactly as prescribed. These strategies are complementary, supportive, and additive. They work alongside medical treatment. They do not replace it. Let me also address something that often comes up when people start tracking their morning blood pressure after implementing lifestyle changes. The numbers do not always move in a straight line. You will have mornings where your reading is higher than it was the week before, even if you have been doing everything right. This is normal. Blood pressure is responsive to dozens of variables, including stress, sleep duration, how much water you drank the previous day, whether you had a difficult conversation, whether you ate something salty, whether you exercised or did not. A single reading means very little. 14 to 30 readings averaged over time means quite a lot. Do not let a single bad morning reading discourage you from continuing, and do not let a single good reading make you overconfident. The goal is a consistent downward trend in your average over weeks, which reflects genuine physiological adaptation. I also want to spend a moment talking about something that supports all of these mechanisms, but that most people overlook because it feels too simple. Slow, intentional breathing. There is substantial clinical evidence that slow breathing, meaning a rate of around 5 to 6 breath cycles per minute rather than the typical 12 to 18, produces measurable reductions in blood pressure. The mechanism involves activation of the parasympathetic nervous system through the vagus nerve, which directly opposes the cortisol and adrenaline-driven state that keeps blood pressure elevated. Some research has shown that even 10 minutes of slow, controlled breathing daily can produce blood pressure reductions comparable to modest exercise interventions. If you sit down to drink your chamomile tea tonight and you spend those 5 to 7 minutes while it steeps, breathing slowly and deliberately, 6 counts in and 6 counts out, you are doing something physiologically significant. You are actively shifting your nervous system into the state that allows nighttime dipping to occur, and you are doing it before bed at exactly the right time. This combination, slow breathing plus chamomile plus hibiscus plus milk, addresses the problem from 4 directions at once: nervous system regulation, mineral support, ACE inhibition, and endothelial function. That is a serious cardiovascular protocol. It just happens to involve tea and breathing. Your challenge starting tonight is simple. Choose one drink, just one. Start with whichever one feels most accessible to you. If chamomile sounds easiest, start there. If you already have hibiscus in your cabinet, start there. If you have milk in your refrigerator right now, start there. Be consistent for 30 days. Same drink, same time, same protocol. Measure your blood pressure every morning at the same time before you eat or drink anything. At the end of 30 days, look at your trend. Compare your average from week 1 to your average from week 4. That comparison tells you whether your body has responded. If you see a positive trend, you now have your own personal individualized evidence that this strategy works for your cardiovascular system. That is powerful. That is data you own. And data removes fear in a way that nothing else can. If you want to add a second drink in month 2, add it then. The goal is not to overwhelm yourself on day 1. The goal is to build a sustainable evening protocol that your body adapts to and benefits from over time. I want to leave you with something that I tell patients when they are overwhelmed by their cardiovascular risk and feel like the situation is out of their control. Your cardiovascular system is not fragile. It is adaptive. It is designed to respond to signals. Good signals move it toward health. Poor signals, and we all accumulate plenty of those over a lifetime, move it the other way. But the system is never beyond responding. The endothelium can recover function. Arterial stiffness can improve. Nighttime dipping can be restored. I have seen it happen in patients in their 50s, 60s, and 70s who committed to consistent supportive changes. You are not too far in. You are not too old. You are not past the point where any of this matters. Your body still knows how to regulate. It just needs the right conditions to do so. In the next video, I am going to cover something that I guarantee most of you are doing every single evening without realizing it is silently canceling out your nighttime dipping. Even if you drink every one of these teas perfectly, even if your diet is excellent, this one habit undoes a significant portion of your body's overnight cardiovascular recovery, and almost nobody connects it to blood pressure. If you care about your heart and you want to protect your nighttime cardiovascular window, subscribe and make sure you see that next video. It might be the most important one in this series. I will see you there.